So far, we are done with the bony features and attachments of sternum, and now we'll talk about ossification and development of sternum and clinicals related to the sternum. So let's begin with the ossification of sternum. As we know, sternum has three parts: manubrium, body of sternum, and the xiphoid process. Each of these three parts, they have their own ossification centers which appear during intrauterine life. We'll talk about the manubrium first. It is ossified from two primary centers, as you can see here, which appear during fifth intrauterine life. Then comes the body of sternum. The body of sternum is formed by fusion of four segments, as you can see here, 1, 2, 3 and 4. Body of sternum is formed by the fusion of these four segments, which are termed as sternibri. Each sternibri has its independent ossification center. There is one center each for the first two segments, which appear in the fifth intrauterine month. Then comes the third and fourth segment. These two segments, they are ossified from paired ossification centers. As you can see here, they have paired centers which appear in the fifth and sixth intrauterine life. The center for the xiphoid process appears during the third year of life. Then comes the fusion of these segments. These parts, they fuse with each other from below upwards. Fusion of the third and fourth segment is completed just after the puberty, whereas fusion of the first three segments is completed between 17th to 25th year of life. This is the manubriosternal joint. This joint, as I have already told you, is a secondary cartilaginous joint. This joint remains ununited throughout the life. It is not ossified. It persists throughout the life. Then comes the fusion of the xiphoid process or xiphisternum with the body of the sternum. This fusion, it occurs at 40th year of life. That's all about the ossification of sternum. Now let's begin the clinicals related to the sternum. The first one is sternal fractures. As we know, sternum is subcutaneous in location, but despite this subcutaneous location of sternum, sternal fractures are very uncommon. They usually occur in the road traffic accidents when the driver's chest is forced into the steering column. But the use of airbags in vehicles has reduced the number of sternal fractures to a great extent. If the sternal fracture occurs, then what would be the displacement of fragments? This is very important. Displacement of bony fragments in cases of sternal fractures are uncommon because the sternum is invested by the deep fascia and the sternal attachments of pectoralis major muscle, which is very strong. It prevents the displacement of bony fragments of the sternum in cases of fractures. The deep fascia and the origin or muscle fibers of pectoralis major muscle, they hold the sternum in place and prevent the displacement of its fragments. The most common site of sternal fracture in elderly people is at the sternal angle, where the manubriosternal joint is formed. In cases of sternal fracture, as we know, the posterior aspect of the sternum is related to the thoracic viscera, which are heart, lungs, pleura and pericardium. So if the sternal fracture occur, it may lead to complications such as the heart injury, for example cardiac rupture, tamponade or lung injury. That is why the sternal fractures are of great interest for the surgeons. The second important clinical regarding sternum is the median sternotomy. What is sternotomy? It is a type of surgical procedure in which a vertical line incision is made along the sternum, as you can see in this image. A vertical line incision given along the sternum, after which the sternum itself is divided into halves and is retracted to gain access to the thoracic cavity for certain surgical operations. Here is an image showing incision of the sternum and division of sternum into halves, and then retraction of the sternum to gain access to the thoracic cavity for surgical operations. The flexibility of ribs and costal cartilages enables spreading the halves of the sternum during procedures requiring median sternotomy. The procedures which require median sternotomy are coronary artery bypass grafting, which in common language we call it as bypass surgery of heart. The second one is exposure for removal of tumors in the superior lobes of the lungs. In this image you can see the retraction of the sternum with the help of a retractor and exposure of pericardium and heart. After the surgery, the halves of the sternum are usually joined using wire sutures, as you can see in this image. This image is showing the crisscross sternal wiring with involvement of the xiphoid process, and this fourth image is showing the crisscross sternal wiring with sparing of the xiphoid process. Another important fact about sternum is that the sternal body is used for bone marrow needle biopsy because of its easy access, as it is subcutaneous in location, so it can be easily accessed and a bone marrow sample can be taken. The needle first pierces the thin cortical bone, as you can see in the image, and then enters the vascular spongy bone. Sternal biopsy is commonly used to obtain specimens for bone marrow transplantation and for detection of blood cancers. The common site for the sternal puncture is upper half to prevent injury to arch of aorta, which lies behind its lower half. As I told you in the relations of sternum, that posterior surface of mediastinum is related in its lower half to the arch of aorta. So the common site for the sternal puncture is posterior upper half of the mediastinum to prevent injury to the arch of aorta. Now the last important clinical regarding sternum is the sternal anomalies. Before starting anomalies, you must know the development of sternum. Sternum develops by fusion of two sternal plates formed on each side of the midline. Fusion of these two plates takes place in craniocaudal direction, that is from above downwards. If these plates don't fuse properly, this may lead to various anomalies, which are complete sternal cleft, partial sternal cleft, sternal foramen, funnel chest and pigeon chest. Let's talk about these anomalies individually. The first anomaly is the complete sternal cleft. What happened in the complete sternal cleft? In this condition, halves of the sternum of fetus, they don't fuse. This is an uncommon anomaly through which heart may protrude. This condition is also termed as ectopia cordis. When the two plates of the sternum, they don't fuse together, there is a gap left in the anterior thoracic wall. Through this gap or cleft, the heart may protrude outwards. This condition is known as ectopia cordis. Then comes the partial clefts. Partial clefts, they involve the manubrium and superior half of the body of sternum. These clefts are usually V or U-shaped. They can be repaired during early infancy by direct opposition and fixation of the sternal halves. Now, what is sternal foramen? Sometimes a perforation remains in the sternal body because of incomplete fusion of the sternal plates. This sternal foramen is not clinically significant. However, we should be aware of its possible presence so that it is not mistaken in the chest X-ray with an unhealed bullet wound. Now let's talk about the funnel chest. What is funnel chest? It is a structural deformity of anterior thoracic wall in which sternum is depressed. As you can see in this image, there is depression in the anterior thoracic wall. In this condition, there is a caved in or sunken appearance of the chest, anterior chest wall. It may be present at birth or it may develop after puberty. Funnel chest is also known as pectus excavatum. Now the last condition is the pigeon chest, which is also known as pectus carinatum. In this condition, the sternum is pushed outwards, as you can see in this image, instead of being flushed against the chest wall. This is the normal adult chest. You can see here the sternum is flushed against the chest wall here, but in the pigeon chest the sternum is pushed outwards. In such cases, there is flattening of the chest wall on either side of the midline like this. This usually occurs when the cartilage and bones of sternum and ribs, they don't properly form. As a result, chest becomes abnormally pushed outward. This condition resembles the chest of a pigeon, That is why it is named as pigeon chest. That's all about the ossification and clinicals of sternum.